In the early 1990s, it was becoming more difficult to remain independent. Every small practice had to accomplish all of the tasks of a small business, and we felt that as a larger organization, we could remove some of the administrative burden that physicians faced, pass that off to a larger organization, and focus on taking better care of patients. COPC is providing outstanding clinical care, and it's time to tell people about that. Payer data shows that we as an organization are providing the highest level of care in the state and one of the highest levels of care in the nation. COPC has always been focused on clinical excellence. That's a given. We also realize that over the last 5 to 10 years, we have modernized the delivery of primary care. This year, we've also decided to focus on mindful service, where we intentionally take better care of each other and our patients.
Our primary goal as physicians in COPC is to provide excellent clinical care from the time you walk in the door to the time you see our physicians and staff. We want to be able to provide care from the time children are born through the process of aging. Providing the highest quality of care for patients is not just physician care, it is truly the entire medical office, and we pride ourselves on providing excellent care with a smile every day at Central Ohio Primary Care.
Taking time with a patient is extremely important in order to help them to the best of my ability. A lot of times it could be asking a lot of questions. A lot of times it could just be hearing what they have to say, listening not only with my mind, but with my heart to see what I can do to help them out. Kindness is showing how much you care about somebody, and it doesn't involve a lot of steps. It doesn't have to be complicated. It could be simple as taking just 1 or 2 minutes looking at somebody and just saying, "How are you doing? What can I do to make your day better?" Mindful service is learning to take feedback from those around you, because it not only helps you be more aware of yourself and what you are projecting to the world, but it also helps improve relationships at work and also helps provide better care for patients.
What makes us unique is that we are physician-owned. We always can look at what is best for the patient and then provide that care. One unique feature of COPC is that we don't just care for the patient at episodic visits. We look after them for the entirety of their care, whether it's starting in the hospital, going to a nursing home, following up in the office, and all of the physicians and nurses in between that communicate with me, the primary care physician. COPC is recognized around the country as being a leader and innovator in healthcare. The models that we have started 5 years ago are now being copied by other healthcare systems both here in Central Ohio and around the country. We have proven them to be successful in managing our patients and delivering high-quality care.
I could not be more excited or energized for the future of COPC and for the future of primary care. Any cultural initiative within an organization requires ownership. Who will own this? It will be all of us. If we are going to be the best for primary care, that requires us to be the best for our patients and the best for each other. Please join us in ownership of this cultural initiative and moving it forward.